Welcome to our Mary Greeley Primetime Alive presentation, Osteoporosis, Knowledge is Power. I'm Vicki Newell, and I'm the manager of the Primetime Alive program here at Mary Greeley. As a reminder, if you'd like more information about Primetime Alive or to sign up for Primetime Alive or for a program, you can go to mgmc.org/PTA. Our presenters today are Christina Johnson and Alicia Lofsted. Christina went to Otterbein College in Westerville, Ohio, where she received her Bachelor's of Science in Athletic Training. She earned her Master's of Physician Assistant Studies from Seton Hall in South Orange, New Jersey. She worked in Northern Iowa and orthopedic practice for 17 years, the last 5 running an osteoporosis clinic. Last year, she transferred to the Physical Medicine and Rehab Department at McFarland Clinic. In her free time, she likes gardening, reading, watching sports, especially women's sports, and visiting her friends and family. And then our second presenter, Alicia, graduated from Iowa State University in 1999 with a Bachelor's of Science and graduated from Des Moines University in 2001 with her Master's in Physical Therapy. Alicia worked in a large hospital in Kearney, Nebraska, and a small outpatient clinic in northern Wisconsin before joining McFarland Clinic in 2007. Outside of work, she enjoys watching her children's activities, taking care of flowers, and walking. Please welcome first Christina.
Thank you guys so much for having us. This is kind of a really cool program that you guys have going on, so kudos to Vicki. I was reading all about it, and it's just very interesting. So I wanted to start off talking about osteoporosis and osteopenia. How many people have osteoporosis or osteopenia? Oh, how many people have no idea? Cool, awesome. Hopefully at the end of this, you'll go talk to your doctor and you'll get diagnosed. All right. Oh, we'll just do this. I'm a medical professional, so we always have to, I have no financial interests or relationships to disclose. Fantastic. So what is osteoporosis? Webster's definition is a decrease in bone mineral density and a change in bone structure and strength. And we're going to see this on the next slide. The reason it's important is it leads to increased risk of fractures. So if you can find the spelling error in this, you get nothing from me, but there is a spelling error. And I will just tell you that I just took it off the website and put it right in, and I didn't even notice it. So there you go. So the stages of osteoporosis. So what you're going to see, this is like a cross section of bone. So on the far left, you have normal bone. So if we could cut your bone into half, this is what a normal everyday bone looks like. If you have osteopenia, that's where your bone structure starts to decrease, and you can see there's a little bit more holes in it. And then as we go to osteoporosis and severe osteoporosis, there's a lot less bone structure to it, and that's what makes it easier to break. And so this is, we can't see this on an x-ray, right? You just can't see it. You're looking at the long bones, you're looking at the bone structure, you're looking to see if there's osteoarthritis, that type of thing. You're not looking at the actual bone. This is something that we would do under a microscope. So what we would typically see on an x-ray is what's called a compression fracture. So what you can see is that the vertebra, which are, I call them Lego blocks because it's just easier, gets just compressed on itself and it becomes a wedge. So it's called a compression fracture or wedge fracture, if you've ever heard that term before. And that's kind of what it looks like. So if we see that on an x-ray, we know this is somebody that either has osteopenia or more likely osteoporosis. So why does this matter? Well, we already talked about the risk of fracture. These are the most common fractures that will happen with osteoporosis. Number 1 is a hip fracture. Most of them require surgery to fix. The mortality rate in the first 12 months is pretty high. Nobody likes those numbers. Nobody likes to, die. Wrist fractures. Again, you need surgery on many of them. You need immobilization. You need to meet with Alicia and do a lot of physical therapy after so you get that function back. We talked about the vertebral fractures, the back fractures. When people say, oh, I shrank 7 inches, it's because they have all these vertebral fractures. They're just compressing on each other and getting shorter and shorter. That increases your level of pain and it decreases your function. Then you have to come see me in the PMR department, and we have to do shots and do other various things. And then other fractures occur more frequently. So these are the most common ones, but you can also fracture your humerus or your clavicle or your ankle or your toe or your finger, any of these things. So who gets osteoporosis? I noticed a lot of women raised their hands when they said, I have osteoporosis or osteopenia. And I noticed the 2 gentlemen right over here. I noticed neither of you knew if you had it. So who's most common? Women, postmenopausal. Why? Because we change our estrogen levels, so that can lead to osteoporosis. Caucasians and Asians are more susceptible to osteoporosis. Believe it or not, African Americans very rarely get osteoporosis. Why that is, we don't really know. It has something to do with their bone structure. It has something to do with their genes. We just really don't know, but they really don't get osteoporosis. Family history. Especially if your mom or your grandma had osteoporosis, you're more likely. But aunt, sister, niece, nephew, well, not nephew, but niece. There's so many different conditions that can lead you to having osteoporosis. These are just a couple. I could do an hour-long lecture on causes of osteoporosis, but that would bore you guys. It would bore me. So long-term steroid use. That's typically someone with asthma issues, breathing issues, some arthritis, rheumatoid things, history of cancer, because that changes your bone structure. It changes your genetic makeup, the chemotherapy, the radiation. Rheumatoid arthritis. But men also get osteoporosis. That's why this is so important even for men. I will tell you that 2 of the first patients that I treated were men, and it's because your hormones change. So either your testosterone level decreases or your estrogen level increases, or a combination of both things, and that can lead to osteoporosis. So, just saying. Other risk factors, again, we talked about the steroids, epilepsy medications, cancer treatments, which we kind of touched on, hormone treatments. So men, if you're on testosterone, that can alter your testosterone levels. It can alter your estrogen levels. That's SSRIs are a class of psych medications, so that can also alter those things. And again, with everything, talk to your doctor before you just stop anything. So how do we diagnose this? Well, number 1 is if you have a fragility fracture, meaning we stand, we twist, we break. So stand, twist, break. You didn't fall, you didn't do anything. You were at height and you broke your hip. You broke your vertebra. You hit your arm on the kitchen cabinet. That's a fragility fracture. It's not from a massive trauma. So that's what a fragility fracture is. So if you have a fragility fracture, you automatically have osteoporosis, because these things shouldn't just spontaneously happen. But most of the time, it's diagnosed by a DEXA scan. So a DEXA scan, and I'm going to show you in the next slide what it looks like. You lay down, and it's a fancy x-ray machine, and it'll take pictures, and it'll do all these fancy calculations, which we'll also go over, and it'll tell you whether or not you have osteoporosis or osteopenia. Now, there's some limitations in this. So it takes measurements at your lumbar spine, your femoral neck, or your hip, and your wrist. Let's say you've had your hip replaced because you had arthritis in your hip. Well, if it takes a picture of that, it's going to look really dense right there. So they can't really use those images. So then we rely more on the spine and the wrist. But let's say you also, when you were a kid, broke your wrist and you had a plate and screws in there. Well, that's also going to change so there's a little bit of a play in it. Excuse me. And then we also look at lab work. Calcium, vitamin D, estrogen, testosterone, There's some other lab values that we look at, but these are the main ones. All right, so here's what a DEXA scan looks like, a scanner, I guess. There's different variations, but basically you lay down and it's going to take these measurements. It's not anything you have to study for. It's not anything exciting. It really doesn't take that long either, but it gives us all the information that we need. So here's where we look at all these things. So some really smart people determine that if you have a 0 level of your bone density, you have normal bone density. Anything under -1 to anything less is osteopenia. Why they chose -1, I don't know. It makes 0 sense to me, but here we are. So -1 to -2.5 is osteopenia, and then osteoporosis is anything under -2.5. And when we get into the -4.0s, which I have seen, that's when you have really bad, severe osteoporosis. So if you remember that slide with the picture of how the bones look, that's the one where there's like no bone structure, okay? It's just all holy, and you are at very severe risk of fracturing something with very minimal effort. So, treatments. We treat the underlying issues. So, remember I said we do calcium levels, vitamin D levels, we check your testosterone and estrogen levels. In men, typically you want to make sure it truly is a primary osteoporosis versus a secondary, meaning the testosterone levels are off. But in women, there's atypical things that can happen. We live in Iowa. I don't know about you guys, but I don't tend to go outside much in winter because it's cold. And so I don't get that vitamin D from outside, right? I get it from a pill. We had a patient, and this is a number of years ago. She was a younger lady. She was probably mid-40s, and she had a really bad tibia fracture that we were fixing. And it's like, why does she have such a bad fracture? Why are her bones just like mush? I mean, it was bad. Well, we did some labs on her. Her vitamin D was way down. She had had bariatric surgery years before and didn't keep up on her vitamin use after. So that's a secondary cause. So we got her vitamin D levels back up. Her bones are now healthy again. So if you treat the underlying cause, you can treat the osteoporosis. Sometimes we have to use medications, which I'm going to talk about, and then physical therapy and fall prevention, which Alicia's going to talk about. So some medications. You may have heard of these. I kind of tried to pick out the most common ones. So oral bisphosphonates or Fosamax. Is anybody on that? No. Okay. It's usually tolerated pretty well. It's usually the first line of treatment. You take it weekly. Take it with I said full sip, but I meant a full glass of water, 8 ounces of water. You do have to remain seating upright for 30 minutes after, just for the digestion. However, the one downside of this is we have found that there's more atypical fractures, meaning you don't break your hip at your hip, you break your femur in the middle, and then that's really hard to treat. So sometimes you take a holiday and switch medications, or we kind of see where you are. Reclassed. Anyone on that? Wow. Oh, yeah. Okay. One. Good. All right. So it's a yearly IV. It's pretty easy. It does a really nice job of helping restore those bones. Prolia. Anyone? Yeah, that's one of the most popular ones. No? Oh, go ahead.
The bone density, it doesn't go back to good though, right? Or does it?
So the question is, can the bone density go back to good? And the short answer is maybe. Some people, yeah, it does, absolutely. If you're treating a secondary cause of the osteoporosis. So like my patient that had a vitamin D deficiency, her bone density went back to normal. For the most part, don't kill me when I say this, but in your age population, mostly we're trying to optimize it. So we're trying to get it as good as possible, which usually isn't normal, but if we can make a difference, then we're preventing fractures from happening. That's a great question. So Prolia, also given via IV, you have to have calcium levels checked before. And with all of these medications, the recommendation is that you do a DEXA scan every 2 years just to check on that bone density and see how we're doing. Yep.
Years ago for a medication and she couldn't take some of these things. And so she had a nasal spray that she used. Do they still use that since it's
Ooh, that gets into the very specific things that I'm not as familiar with that, unfortunately, anymore. The question was, is there still a nasal spray? And I'm sure there is some good stuff, but having been out of practice with this for over a year, I haven't kept up on everything. Anabolic therapy, this is usually a shot that's given. Usually it's called Forteo is the big one. And this is reserved for high-risk patients, those patients that are at minus 4.0 and more. The biggest thing and my key takeaway from this, if you retain anything, is prevention, prevention, prevention. Avoid smoking. We all know the dangers of smoking. It's preached to you at every doctor's appointment, but smoking does decrease your bone density. Avoid excessive alcohol usage. Again, this is something your doctor talks to you about at every visit, but alcohol siphons away some of the good vitamins in the body and makes it so that your bone density goes down. Healthy eating habits, vitamin D and calcium ingestion. You just heard my story about my lady that was vitamin D deficient. So what has this? Obviously, you have your usuals. Cheese, milk, ice cream. Yeah, that's how I have to have my calcium, so I have to have ice cream every once in a while. It's okay. It's cool. But also things like beans and greens also have calcium and vitamin D in it. And vitamin D naturally comes from the sun, so also a good thing. Just wear your sunscreen. Moderate weight-bearing exercises, walking and strengthening exercises, which I'll let Alicia talk more about. Better genes? I don't know. Tell your daughter, granddaughter, anyone to start calcium, vitamin D, get them as active as possible. Personally, my grandma had osteoporosis very badly. She also had hypothyroid, which is not something I talked about a cause for osteoporosis. I also have hypothyroid, so when I was 18, I started taking calcium with vitamin D just because I didn't want to shrivel up when I got to be her age. So it's really important to share this information with your children. Yes.
Vitamin D, is that over the counter or a prescription?
So the question was calcium and vitamin D over the counter or prescription, and it's over the counter. There's many different brands out there. Some of them have other elements with them, but just the basic calcium and vitamin D, one pill once a day, as long as you're eating a balanced diet, is good. There we go. So calcium and vitamin D intake recommendations, these vary by age. For women, it also varies whether or not you're pregnant or lactating. So these are just some ideas, but you don't have to know this and have it preaching to you. And then I just put in there some resources for you guys if you were interested in anything more. I mean, a talk on osteoporosis honestly could be 3 and 4 hours long, but this is just a basic overview. So I am going to, this is my fun slide. So everybody needs calcium in their diet. This is my tortoise, Shelly. Shelly is a tortoise. He has a shell, so he also needs some calcium. So he isn't like any other tortoise. I have to give him shaky calcium on his food, and it's not cocaine, I promise. I'll just leave it at that. And then I'm going to turn it over to Alicia here. Oh, yep.
Those bones, osteoporosis, it's all bones.
Yes.
How come orthopedic doctors, because they're bone specialists, how come we don't go to them? And I know of a clinic down in Des Moines that is going to, they have an osteoporosis clinic. I mean, it's a branch of theirs. Mm-hmm. And they encourage everybody in Des Moines to go there. So I never could understand why
So the question is, why does orthopedics not take care of osteoporosis? And the short answer to that is they do fix all the fractures. So they are sort of taking care of the osteoporosis. But what I will tell you is they don't have an interest in seeing these patients and working them up. I don't know why. I did my osteoporosis clinic out of an orthopedic clinic, but we'll get too political if we keep going, so I'm going to leave now.
Hello, my name is Alicia Lofstead. I'm a physical therapist for McFarland. She's already introduced me a little bit, but here a little bit more about me. I've been to Iowa State, Des Moines University, and now I work at the West Clinic. We have 5 clinics in town. This is my reason for getting up in the morning, these guys. 3 kids, and the oldest just came home for his first summer from college, so life is good again. So your doctors are always telling you to exercise, and we'll go over that and why that might be helpful for osteoporosis. So we all know that it helps to manage chronic diseases like high blood pressure, high cholesterol, diabetes. It also combats stiffness. We're going to talk a lot about fracture prevention, fall prevention. Stiffness can lead to soreness and increased chances of falling, so we want to help avoid that. It helps to improve muscle weakness. We're less likely to fall if we're stronger. Bone grows when it's stressed. So when the muscle contracts, that pulls on the bone and helps it to stay stable, grow. That's where muscle exercise comes in, and we'll talk about that a little bit more specifically. It helps to improve balance and decrease your fall risk, and it helps to slow your bone loss. We don't know how fast our bone is going to be lost because it's different for everyone, but exercise can help slow that bone loss. Okay, so there's good news and bad news. Let's do the good news first. The data suggests that fracture prevention can happen from exercise. A meta-analysis, which is a lot of different research articles, were looked at, and in 13 trials, over half of the people had less fractures, or it found that exercise halved your incidence of fractures. That's pretty good. The bad news. As in all research, it's always continuing. There's a difference in opinion on what exercise to do. I can't tell you that you can do 10 of one exercise and you'll be great, and at 9 you would get a fracture. There's no perfect amount. The other thing that's hard is that changes in bone mineral density take months. We can't work for a week and have greater bone mineral density. It's a long-term project. So before you begin your exercise program, if you have questions, you can talk to your doctor. They can help you kind of give you guidelines. You need to understand the exercises. Google is a great research tool, but if the exercises don't make sense, they're not going to necessarily be helpful. We want to perform a gradual increase in our exercises. If you're not used to walking on a regular basis, this isn't time to start doing a 5K. We need to slowly build up our exercises. Some of the exercises that you might see or get from your doctor, physical therapy, or the web might suggest doing some stretches, and they might show them on the floor. But if getting off the floor is too difficult, do them on your bed. Exercises can make you feel a little bit different than you have for a while. They can make you kind of sore after the first time, that sort of thing. And that's not a bad thing. But if 2 days later you're still sore from that, then maybe it was too much. We don't want to fall. If you feel like you're going to fall, don't do that exercise. If this just doesn't make sense or those exercises aren't working out for you, talk to your physician and see if you can get a physical therapy referral. You know, maybe just 2-3 exercise sessions and we could get you on a good home exercise program. So what type of exercises? There's a lot of different exercises, and we're going to go through them quickly first, and then we'll go through them a little bit slower. Strengthening exercises about 2 times per week. Posture exercises daily. Balance exercises daily. And aerobic physical activity. It can be a combination of vigorous or moderate. If you're doing moderate exercise, up to 100 or around 150 minutes per week. If it's vigorous, it's 75. And we'll go into what those mean in a little bit. Strengthening exercises, like we talked about before, when you contract those muscles on the bones, it helps to keep the bones strong. We want those a couple times a week. Sets of exercises are made up of repetitions. So like one set could be 8 to 12 repetitions, 15 to 20 reps. If you feel like you're not, if you're kind of frail and you want to use lower amount of weight, and you want 2 to 3 sets of those. How challenging should it be? If I can lift a 1 pound weight 100 times, that's probably not too challenging. You want those last 2 to 3 reps to be challenging. By the time you get done with those 8 to 12 reps, you want to go, ooh, I need a little bit of a break. So let's go through some example strengthening exercises. If you look, all these people seem happy exercising. There's exercise bands, body weight resistance, like squats, lunges, push-ups, and then there's weights. She's especially happy. Dumbbells, weight machines, posture exercises. So when we think of posture, we're thinking about what can keep us upright. Most people have some curve in their upper back, and that's normal, and that's okay. It's when you start to have more of a curve that we worry about those compression fractures. If you think back to what Christina had with those pictures of the vertebrae, usually compression fractures occur more into a kyphotic posture. And so if we can stay upright, that doesn't put as much pressure on those vertebrae. We want about 5 to 10 minutes of those posture exercises. So when we think about those are things keeping us upright, keeping our core strong. Stretching the chest muscles, that's the one where she's standing at a doorway, just stretching the front. Squeezing the shoulder blades together, keeping us tall. Rows, that's the one with the bands. Planks, everyone's favorite, that's where she's on her toes and elbows. Bridges, where you're lifting your bottom up off the bed or the floor. Standing hip back kicks. That's where you're standing and tightening those glute muscles, getting those back muscles a little bit stronger or lower. Another exercise is balance exercises. We need the balance to keep us from falling. You're more likely to fracture if you fall. When you're exercising for balance, you want a good sturdy object, a countertop, a sturdy chair, shoes with good traction. I have a lot of patients tell me that they find it easy to do these when they're brushing their teeth or brushing their hair. Some sample balance exercises. These all depend on where you're starting at. Some of them might feel way too easy. You just keep feeling until it feels challenging, like, ooh, I could lose my balance. Standing with your feet together, eyes open or eyes closed, trying to stand on your heels or walk on your toes. Standing on one foot, I have highlighted because this is a really hard one. The nice thing about that is that when you stand on one foot, that's putting extra weight through your leg, and that helps to increase your bone density. Standing with one foot in front of the other. If you're more into exercising with a group, Tai Chi or dancing, yoga, Pilates, Tai Chi, those are very popular. We're going to go over things to avoid down the road here, but you just want to be careful. When you look at some of these postures, they involve some twisting and repetitive forward bending. If you're having osteoporotic fractures, we want to be careful with that, and we'll go over that in a little bit. This gets more into the aerobic physical activity. If you look on the right, there's a spectrum from 1 being rest and 10 being maximum exertion. When we think about aerobic exercise, We want to do at least 10 minutes at a time, if you can. This will help to reduce your risk of diseases. We want to do somewhere between 5, somewhat hard, and 8, extremely hard when we're thinking of aerobic exercise. That's getting your heart rate up. It goes anywhere from you can talk, but I couldn't sing, to, boy, that's kind of hard. I don't think I could talk. If you are just new to exercise or concerned, start with a lower, light amount of perceived exertion. When we're doing those aerobic exercises, we want to keep them in weight bearing. So swimming is wonderful for your heart, but not so great for your bones. Biking is great for your heart, but not so great for your bones. We need that impact through our body, either through our arms or our legs. So impacts might include jumping, sports, walking, stomping. Racket sports gives you some impact through your arms. How much weight-bearing exercise should I do? Well, this can vary, and this is where those studies start to have some different ideas. People without osteoporosis, or most people with osteoporosis, can do about 50 moderate impacts most days without any trouble. If you have a history of spinal fracture or you're unable to do that moderate exercise, think about lower impact things like walking. If even the walking seems like too much, you need to avoid prolonged sitting. Stand up a few minutes every hour just to get stretched out. What if I have a history of osteoporosis, history of spinal fracture, decreased balance? This is where we're going to go over the precautions that you want to pay attention to. First of all, choose an activity that feels safe to you. This isn't the time to take up roller skating. You may need to avoid high impact activities. Once again, we don't want to fall. Activities that involve twisting. Golf can be great, but if it hurts or you have had a history of spinal fracture, golfing might not be the best because you're twisting in a weight-bearing position. Activities you could easily fall. Exercises that bend forward repetitively. I've had very few osteoporotic patients get mad at me when I say no more sit-ups. So, lifting heavy objects, if it compresses that spine more, that increases your chances of fractures from the compression fracture. Use a walker or a cane if you need one. Even when you're exercising, if you want to go for a walk outside and you're worried about bumps on the ground, take a cane or a walking stick with you. Strengthen your back muscles. So if you've had osteoporosis and a history of spinal fractures, even with daily activities, try to bend down with a neutral spine. You've probably all heard about bend at your bend at your knees, not at your waist. That's what she's doing here. Avoid sit-ups. Avoid resisted twisting. Now, we have all decided why we don't need to exercise. I'll give you some reasons how we can get out of that. The fear of falling. Have that sturdy chair or counter in front of you. I have a lot of patients, like if they have a walker or a sturdy chair, they'll bring it in front of their bed so that they can do their exercises standing, and if they lose their balance, the bed is right there. Fear of going outside. There's a lot of stuff you could do inside. Don't worry about not going outside. Expense. A fitness center is expensive. Luckily, those bands and weights can usually be bought online or at a store just in town. And I don't want to exercise. If you don't enjoy it, look for something else. If you can get a friend to do it with you and you can talk during that time, that can make it more fun. Or if you tell yourself, okay, if I go walk for 15 minutes, then I can come back and read 30 more pages in my book, something like that. Once again, we want to prevent falls. If you're having trouble with your vision, that increases your chances of falling twice as likely. That's a lot. Have your medications reviewed if you're concerned about that. If it makes you dizzy or sleepy, talk to your doctor or your pharmacist about this. I had a patient just recently that she was complaining she was dizzy, and I took her blood pressure, and it was 77/50 something. I said, let's talk to your doctor. Other ways, lots of fractures and falls happen at home. What can we do at home to make it safer? Removing tripping hazards. I love my grandma, but the amount of throw rugs that she had was crazy. She would hide them before home health came. Electrical cords, shoes, anything you could trip on. If you're having trouble getting off the toilet or sleeping in the shower, have a grab bar. Non-slip mats in the shower. Handrails on staircases. I have so many patients that when they come and I ask them to show me how they do the stairs, they need both hands to hold on, and I say, okay, what's it like at your house? Well, I don't have any rails. That really adds a lot of safety. If you have to get up in the middle of the night to use the restroom or whatever, you don't need a blaring light, but just have something, a little night light, so you're not walking in the dark. I'll have patients try to stand with their eyes closed and they about tip over, and I say, now how are you gonna walk in the dark? That's just like walking with your eyes closed. If you're gonna walk with slippers, make sure they're not slippery. If you get a step stool, if you have to get up on a step stool, get one of those with a little rail on it. Avoid just standing on a step stool. And if you're having some trouble getting dressed, feel free to put a chair in your bedroom. Then you can sit down to dress. And then put frequently used items waist and shoulder height so that you're not having to crawl on the ground to get something in the back of the cupboard. Once again, keep a healthy posture to try to keep yourself upright so we don't get into that kyphotic motion. And then use good lifting mechanics. Like we've all been taught, lift with your legs, not with your back. Keep it close to you and ask for help if you need help with the weight. So, summary of everything. Be safe. Don't start skating if it's too hard for you. Have impact through your limbs. We want to have impact in a weight-bearing position. Use good body mechanics to avoid falling and to avoid compression fractures. Keep exercising. If you stop exercising, then those gains that you worked so hard on could be lost. And remember that gains take months. Don't get frustrated if after just a little while it doesn't feel like you've noticed a difference. And the most important is make sure you enjoy it. Having fun and getting positive feedback from your exercises will make it a lot more enjoyable. Questions?
And I have the microphone, so go ahead and raise your hand with your questions. I'm going to ask quick, Tim, do you have any questions online? Tim, you might have had to step out.
I'm looking. Yes.
Okay, go ahead.
Okay. My x-ray this week showed that I have osteopenia in all my toes that are not curled up. So it's all bones that get osteopenia? Osteopenia? Please explain.
Yes, any bone in your body can get osteopenia. If you have not talked to your doctor about getting a DEXA scan, I would get on that so that we can see what your other bones look like.
Any other questions there, Tim?
Nope, that's all.
Okay.
The calcium and vitamin D recommendation charts end at 50 years old. I think most of us are over 50. Please help.
Yeah, I couldn't find any that had anything older than 50, so I would just stick with the 50-year-olds and continue on with life.
You are all young at heart. How about that?
I will
So,
say I did giggle a lot when I couldn't find anything different, so.
Well, maybe once you get to that age, but maybe they don't change the rec. It doesn't say 50 plus. It just says 50. Okay.
Yeah. Hi, I have two questions. The first one, is there
can you have too much calcium? Does it cause any other problems?
Yes, you can absolutely have too much calcium. That's when you get kidney stones, among other things. So yes, absolutely.
Okay. And then this is a little off topic, but talking about exercises. If you have arthritis, should you still work through that pain to get the exercise or?
So that might be a time when you want to talk to your doctor or PT. What we usually encourage is a little bit of achiness is okay, but no sharp pain.
If any of you have seen me as a patient, I like to say, we like the, we don't like the,
Along with the question at the other side of the room, is there too much you can take at one time? Like, could you take 2 tablets, 600, 1200 at once, or should they be separated?
No, you can take 2 tablets at once. That's okay. As long as your calcium remains in the normal scale. Your primary care provider should really be checking that, but it's very common that 1 or 2 pills a day is very normal dosing.
Now, I don't take any over-the-counter medicine because you start taking it and then they say it's not good for you, baby aspirin on. And now you're saying there's a possibility you can take too much calcium. I know everybody's body's different, so wouldn't it be better to go to the doctor and get a script? Now, I have a script for vitamin D because...
I mean, you can, but it's certainly readily available over the counter too, so it's just your preference.
But how would you know? You know, you got to make sure you're not taking too many, like that lady asked, or not enough. If you do over the counter, it's your guesswork.
In order to get to way high levels where you're going to have those kidney stones and stuff, you're going to have to take a whole bottle a week, and I don't think anybody's going to do that.
So correct me if I'm wrong, because I was just encouraged by my doctor to start taking vitamin D, and she told me how much she wanted me to take. So, I mean, it would seem to me you could ask your physician, you know, even though it's an over-the-counter, I think they'll still tell you what their recommendation is. Right, but like you talked about the calcium.
Yeah, because that concerns me that, you know, she's saying you can take too many and have a complication.
Was it?
Not enough, and that probably doesn't do you any good. So I guess I, you know,
Right, but I think that's where she's saying just the same as a doctor would write a prescription and a certain amount, he would surely
gonna
tell you
tell-
the same amount.
Yeah, they're going to tell you how
They're
much
going
they
to
want
tell you, even
to
if it's
take.
over the counter, how much to take.
I'm being very vague because I don't want to give you specific recommendations, not knowing your exact history.
I would suggest that you check with the pharmacists because they are the ones who know. The doctors do not, as far as medications.
they don't want to tell us. They don't want to know. They send us to the pharmacy.
I am doing some, you're talking about exercises, and I have arthritis in my feet, so I go to a pool and exercise. And you don't like, to me, what I've just heard, you don't like that because it's not strength building. But I also go to a reflexologist that works on my feet and my legs. And I'm also going to call a stretch zone, and they're working my lower body and doing the exercises for me. So I don't know, am I doing good or bad?
Well, you might be doing great for certain things. Will it change your bone mineral density? Probably not, but you're getting other benefits.
Such as what? What are the other benefits?
Well, you're probably getting some aerobic exercise in the pool if you're getting your heart rate elevated. You're getting maybe some of your posture exercises if you're working on some stretching in the pool or with that the group that you talked about. So you're covering other things. It
Would you
just
get some good resistance?
You would get some resistance.
Okay.
Yeah. Yeah. It's just the recommendation would be also to do some weight bearing stuff on land if you
land.
can. Maybe some walking.
Yeah, arthritis.
Well, yeah, I think that was then the arthritis in the feet, that concern.
Yeah. So if you can't, you can't. Maybe talk to that group that you're working with and just see if they have any recommendations maybe for some band exercises that you could do in sitting, and then you could work on strengthening.
Yeah, I have all of those.
Okay, so you're getting some. Yeah.
Sounds like you're doing well.
We're talking not necessarily when they talk about swimming, they're talking about like if you go do the backstroke for 3 hours and do laps. There's no weight bearing with that compared to standing aerobics.
Oh, okay.
When you're chest height in water, you're about 50% of your weight bearing. So if you think of it that way, you're getting, depending on where you're standing in the pool, you get about maybe half of the weight bearing from when you're up on land.
When I'm in the pool, I'm doing the same exercises that I used to do when I was on land.
Okay. So yeah, you're getting about 50% of your weight bearing maybe, and some strengthening and some cardio.
Okay.
Yeah,
And if that's what you can do,
that's what, it's
That's
better
what you-
than, yeah.
right.
That's
He's
good
very-
that
yeah.
you're doing it. Yeah.
Very good. Any other questions here? Tim, any on?
Online question.
Okay, go ahead.
Yeah. Do you know of any yoga classes that are specifically safe if you have osteoporosis?
I am not sure about yoga classes. In the past, the senior center has had some Tai Chi classes, so they might have some yoga classes. The city of Ames also has SPIF classes, which are specific for 50 and above to be a little bit safer. Those would be the two places I would suggest to look.
And the new 60 Forward building that will be opening now, the latest I've heard is maybe August at the earliest. They're going to have a really nice weight room and fitness area. And I know they've talked about both yoga and Tai Chi down there. So, and that will be both, Mary Greeley and the city of Ames are doing some of those classes down there. So the 60 Forward building is going to be on the same site where the old senior center was. They tore that down and they're rebuilding.
There is a place in Boone that does chair yoga on Wednesdays. It's called Chrysalis. It's on Story Street in Boone. If you're interested in chair yoga.
Very good. Any other questions? All right. Well, Christina and Alicia, thank you so much. Great presentation. Lots of really good information. If you don't mind maybe staying around, there might be people that want to ask you a few other questions. I'm just going to close it up here so we can thank everybody. Everybody here in person and everybody online, thank you for joining us today. Just want to remind you, our next program is Tuesday, June 4th. It's addressing protein and food safety concerns for older adults. And that same week, then Thursday, June 6th, both of them at 2:00 in this room and offered virtually, Population Health, helping you get more out of your Medicare wellness visit. So those of you here in person, if you don't mind filling out your evaluation, giving us ideas for other program topics or presenters you'd like to hear from, and you can turn those into the table at the back there. And once again, thank you so much, both of you, for presenting today. And thank you for everyone for coming out. Have a great day.